move on to the next session. The next session is from Mr. Agendra Kumar, President ESRI India, and to take us through the process, I request Mr. Ganesh Chandrasekaran, consultant from Samsung Research Institute. Over to you, Ganesh.
Yeah, thank you, Raghu, and thank you, Niranjan. So after Dr. Devi Shetty's interesting presentation and also a session by Mr. Abhishek, I would like to introduce our next speaker, who is Mr. Agendra Kumar. He is the president of ESRI India, a provider of geospatial technology. Mr. Agendra Kumar has over 30 years of experience in the IT industry and in the past has held senior leadership roles in several multinationals such as Digital Equipment, Silicon Graphics, Veritas Software, and Symantec. He is also the Senior Vice President of the Association of Geospatial Industries. Over to you, Mr. Agendra Kumar, and the screen is all yours.
Thank you, Ganesh. Am I audible?
Yes.
Okay, good. So thank you for inviting me to speak in this session, and also we had a talk by Rekha and Dr. Devi Shetty in the morning. It's been a very enlightening sessions so far. A lot of good information. In my short talk, I'm going to speak about GIS, Geographical Information System, as a technology, and how it is helping us in fighting COVID-19 pandemic. Before I get into in my presentation as such, I have a bunch of slides. So before I do that, I just want to spend a couple of minutes in explaining what GIS means. So a geographical information system is a framework for gathering, managing, and analyzing geo-referenced data. So is the important term here, and what it means is that anything that has a latitude and longitude. So that's what GIS comes into picture. It organizes layers of information into visualizations using maps. So in very simple terms, those we all use Google Map. So that's a kind of consumer GIS system because it has information about road networks, about various buildings, about traffic patterns. So these are individual layers. So there's a layer of road network, a layer of traffic, there's a layer of points of interest. So it's a mini GIS system which we use as an individual. But when you look at organizations, it's an enterprise GIS technology that plays a role, and so that provides a lot. It has many more layers. People can customize layers. People can populate their own data on a GIS system. So GIS as a technology deals with location information. So it helps in mapping. Like when we apply it to COVID-19, it helps in mapping COVID-19 positive cases, health facilities, tracking the movement of people over a period of time, and especially if they're in quarantine, they're still moving around. This is done through integration of mobile data. So there are other technologies which can be integrated along with GIS. And GIS can help in analytics of finding trends under pandemic situation, kind of situation that we have right now. For example, relation of factors like age with other demographic information with COVID-19 positive cases. And all this data is presented on maps, and analytics are presented in form of dashboards. So I will, are my slides visible?
Yes.
Okay, so let me move to the next slide. And this is about understanding and responding to COVID-19. So there are 5 stages that we've classified. So first of all, you map the cases. Wherever you find a positive case, you capture the location and you bring that on a map. Then once you have many such points of positive cases, then you sort of start seeing some trends that how the pandemic is spreading, in which area it is moving. So you sort of start mapping the spread, direction, district, how's it going. And then you look at vulnerable populations, people in areas where there are people with old age, or there are people who are not educated, or people small dwelling units where the density of population is very high. So you start mapping those things. It's just to be prepared. And then you map your capacity, that how many hospitals I have, how many beds I have, uh, how many ICU beds I have, and things like that. And then you communicate through maps with each other within the government setup. Next stage comes about modeling and spread of impact, spread and impact of disease. So here what happens is we try to understand the communal risk, that how it can spread, which are the densely populated area, and whatever actions we are taking, we try to measure the effectiveness of those actions. Like we did a lockdown in the country, what was the impact of that? If we create a containment zone, what's the impact of that? Then you manage the resources. Like in some areas you may require more ventilators and things like that, then you move them about. And then you look at different site selections for, say, setting up quarantine centers and things, isolation centers. And then you start communicating with public, you keep giving information to public. So on a map you know different areas, so you can give areas alerts to people. So that's what technology brings. So basically GIS provides an integrated system for management of COVID-19. So it's not only COVID-19, this technology has been used in the past also for situations like when we were dealing with Ebola or Zika, or things like polio eradication all over the world, or tackling malaria instances. So it's a technology which is not specific for COVID. It can be used in many other situations. So basically what happens is it helps you in mapping various things that I mentioned, getting the data on a map so that you can visually see the information, and then you create dashboards which give you picture at a glance, and those dashboards can also be used by government authorities to make decisions. And once you have a lot of data coming in, you start running analytics, that how the disease is spreading, the trends, and I'll show you some examples of that. And then you bring data science into it. You get MI, AI, ML, you get big data analytics into that. And then we also have mobile devices which can be used for creating the data, collecting the data about positive cases and things like that, and all the how many people are there in which quarantine center, so that kind of information can be captured. So this is an example of a dashboard which was created by NDMA early in March. Around 10th of March, this dashboard was launched, and this is a snapshot here. But I will take you to the online picture of this. I'm sorry, I think I've closed that one. Yeah, here it is. So this is the online picture. So this is the latest data. Is the data updated on May 1. They update it a couple of times every day. So you see the latest on the left side. You see the latest confirmed cases. You see the trend, that how many cases are coming total. What's the cumulative cases every day? And if you come on the right side, then you see statewide pickup, that each state has how many. If I click on confirm, then you see daily statistics of how many confirmed cases came every day. So as you move the cursor, you get to see the information about every day. And the next step provides the information about recovered cases. And the last step provides the cases where we unfortunately lost some people. So this is basically one of the dashboard which NDMA has. This dashboard is in public domain. There are a lot of other analytics they are doing which is not in public domain, which is being used internally by government for taking certain decisions. Then we move down to the next slide in my presentation, which is another example from Tamil Nadu, where they have classified red, orange, and green areas. Now we are all hearing that governments are classifying areas into red, orange, and green, so that they can decide where to exit first and where to take more actions before we can exit. And here also they have a graphical representation of positive cases, active cases, and discharge cases. So that's their way of looking at the information for decisions by the Health and Family Welfare Department. Here's something which is created by Punjab government, and this is also a similar map which gives them information about each district, how many cases are there. The bigger the circle, more are the cases. And then at the bottom part, they also have a representation in form of a bar chart, that how many cases are there in which district, so that they know where to focus more, which districts have less cases, and where activities can start first. Another example about Jharkhand state, they also created a similar dashboard, and they are looking at how the pandemic situation is changing. So they're looking at various districts, the number of quarantine centers, and how many people are in quarantines. So all that information is available here. So these are some of the examples of the usage where GIS has been used by various state governments. And then in Bangalore, there's a slightly larger initiative they took. They created a war room where Chief Minister himself periodically comes and looks at the situation on a map. So here's a map which gives them district and city-wise information about COVID-19 cases, and they can run different kind of analytics and different what's going on in different districts, and what are the resources available, and how the district authorities are able to tackle the situation. So it's a much larger screen, so that's a difference, and a lot of real-time data which gets captured in different districts that comes on this in this war room, and the government is focusing about making decisions that how to contain the spread of coronavirus. And that brings me to my last slide, where so far we have seen we have come in a journey of containing COVID-19 at a certain level. We have been in the condition of lockdown for about 40 days now, close to 40 days. The plans are to exit from this, so GIS can help in exit and further management of the disease as well. So this technology has helped us in contact tracing and tracking. It's possible to track people's movement when they don't adhere to the quarantine guidelines and they move around. That happens by integrating mobile data with the GIS maps, so that we can know up to what distance they are moving around, and that will help controlling the spread and bringing it under control, and management of red, orange, and green zones. So these are dynamic dashboards. So as some of the zones come out of red and orange, from red to orange, orange to green, those get updated periodically on the maps, and decisions can be taken. For long-term management of disease, because there could be coming up after a few months also. So where they are occurring, what steps to take, how to contain the spread, GIS will play an important role there. And also when the administration of vaccine starts, it will be a mammoth exercise to give vaccination to everyone. So like it was done when polio was eradicated, every individual case of polio was mapped. I think a stage will come when we will have to map every place where vaccine has been administered and where it is yet to be administered, so that the entire population gets covered. So I think GIS can play a very effective role in all these segments. That's all that I had. Thank you, and I'll be happy to take any questions.
Yeah.
Thank you.
Thank you for your presentation, Dr. Mr. Agendra Kumar. So there are a few questions related to the area in which you just spoke about. It's about Mr. Hemant Jain has asked a question about the accuracy and the confidence level you are able to achieve by this solution. And the second part of the question is, if patient-specific app having GIS interfaces influence, then how GIS can detect accuracy?
Okay, so see, most of the mobile phones today, given the technology that we have, they can capture the data with about 15 meters accuracy. Okay, so to that extent, the location can be accurately captured. Now, if we have a mobile app where you have a GIS interface along with other features, and there are many states who are using such apps, and Punjab is using, Rajasthan is using, and they have been using it very, very successfully. In fact, apart from that, in Bombay, MCGM is using a couple of mobile apps. They have app for their own MCGM staff, for the municipal staff, and also for citizens. So in these apps, the one big thing which is being done today is to provide the information to people. Secondly, if you look at Arogya Setu app today, it does not seem to have, to my knowledge, it does not have a GIS interface as of. But if we have a GIS interface on Arogya Setu app, then it will be, today we look at Bluetooth, there's the person close by, but once we have a GIS interface, the location of that person will be visible on a map, not only to the person, but also to authorities. And the movement will also be visible through map to the authorities. You don't want to give the movement to every public, but authorities will have the advantage of looking at the movement of infected people or the people who need to be watched, because there are suspected cases where they have had exposure to someone and they need to be tracked. So I think GIS interface will help in doing those things very effectively.
Yeah, there are a couple of questions in similar lines, which is from Aishwarya Shwed, where they're asking that can GIS be used to monitor the compliance of lockdown, and can GIS be used beyond the pandemic?
Yes, so GIS, there are two questions in this. One is that can it be to track the movement? Yes, it can be used to track the movement of people who are not adhering to lockdown and they are moving about. So that is possible by integrating the mobile data along with GIS. And the second question was whether it can be used for after the
Yes.
COVID gets over. Yes, of course. GIS used for health applications in the past also, and it's a technology which is not limited to health sector alone. GIS has been very effectively used in many other disaster situations like floods or cyclones or earthquakes. And it's like a horizontal technology. It's used in mapping. It's used by utilities. It's used by telecom companies. It's used by water resources, water distribution. So it's used in many areas. In health sector also going forward, I think states can use GIS technology to ensure that they have enough resources in their state, like enough hospitals, looking at the population, how many hospitals are required, how many beds are required, what are the other health facilities available. So it's sort of a GIS system, which will help in managing such situations in the past in a much better manner.
Yeah, one last question, and I think before we end the session, it is related to like how GIS can be used for forecasting the transmission rate of COVID, and this is from Neelam.
Okay, right. So what happens here is that see, when we look at forecasting the transmission rate, it's become a little complex. We have to bring in the machine learning concepts here. It is being done in certain areas in our country also. So basically, we start looking at trends, and now now that we are in about almost 2 months into COVID-19, we have some data, and we have good number of cases. We have about 7 lakh plus tests which have been done in the country. So we have some trends available that in which area, if you do this many tests, you get this many positives. So I think that data is being used to create some trends and forecasts.
So thank you, Mr. Agendra Kumar. It was a wonderful presentation, and I think a lot of insights have come in and which would benefit the viewers. And I think there'll be quite a few questions which you can take it offline. Thank you.
Thank you so much. Thank you.
Thank you, Ganesh, for wonderful moderation. Agendra, I think almost like 5 to 10% of the innovations across after the COVID pandemic will just got exploded all around about tracking and tracing, and your insights are very, very useful. I think we'll have a long way to really explore the possibilities of GIS, for not be just for the COVID part of it, but for even general healthcare.